What's going on, guys? So I've got a little knee model here today. We're gonna do a little bit of education on the knee as it pertains to Jiu-Jitsu, kind of the basic anatomy of the knee, and also kind of how the things function around the knee here. So this would be a typical, now it's not the best knee model, so kind of take this with a grain of salt, but this is a typical right knee. So we've got the femur right here, this big thigh bone. This is your tibia here, and then you have your fibula here, okay? So this would be your right knee, and if we look at the basic anatomy of the knee here, this would be our patella or our kneecap. You can kind of see the back of it here. You have your quad tendon, and then your patellar tendon. The MCL, the medial collateral ligament here, and what that does, it prevents your knee from moving in this capacity. So like your knee buckling in would be an MCL, be involved there. If ever your knee buckles out, your LCL, so you can see how the LCL gets stressed there. On the inside of the knee, if you guys can see here, right about there, if you can see that, that is your ACL, and that ACL keeps your shin bone from coming forward. It stops your shin bone from protruding forward. The PCL is back here, and the PCL stops your shin from going backward, okay? Then we have the meniscus. So this little blue, these little blue discs, you can kind of see in there, those little blue discs there on the, you have a medial and a lateral. So medial will be the inner part, lateral is the outer part. And that's kind of a cartilage, kind of a cushioning for the knee. This meniscus, the medial and lateral meniscus, are quite frequently injured in Jiu-Jitsu, and the injuries to the meniscus, when we talk about that, basically a lot of times is a rotational injury. It could be even a traction and a rotational injury. So basically, you know, where the shin and the top of the leg are going in different directions, or one part of the leg goes. And so that a lot of times will damage or tear a meniscus. You know, also a traction type injury, so anything where the knee gets kind of separated, the bottom and the top of the knee gets separated and then rotated, that's a big way that the knee gets injured. And one way that I've seen this injury happen a lot, you know, besides stand up, you know, if you're standing up and going for a shot, or somebody's taking you down, you're trying to base or trying to, you know, keep your balance and twist the leg, that's part of it. But the lockdown's been a position that I've seen time and again has been an issue for a lot of people. And a lot of people aren't terribly familiar with the lockdown, or some people use it in a way that's kind of not the nicest way, you know, they'll really crank on it. So you have to be really aware of that lockdown position, because what that lockdown position does, it will take the knee and it will traction it, so it'll separate, and it also will twist it. And what people do a lot of times, which is incorrect, is they will try to pressure into the person on top. So if they're on top and the person on bottom has the lockdown, the player on top will try to force their pressure up into the other person. And what that essentially does is, when their knee is being, you know, held stable by the lockdown position, they'll traction themselves, and then they'll separate that knee and they'll rotate it. And then what'll happen is you'll get a meniscus tear in that capacity. So that's it, guys. If you have more questions, shoot me a comment down below, and protect your knees. See you next time.